Hi everyone, I'm Amy Pickering. I'm actually new to Berkeley starting in January, and I have a joint appointment between Civil and Environmental Engineering and the Blum Center for Developing Economies. And I'm really excited to start working with students in the field of development engineering. I think that when I was a master's student, if this master's program was available, I would have enrolled in it and done this type of master's. So you can go to my next slide. I'll just say a little bit about what my lab does. So my lab is focused on trying to disrupt intergenerational poverty through improving human health. And we work on designing, evaluating, and scaling new technologies and services to improve human health, mainly in low-income countries. And so typically these projects involve three components. So developing the technology, which usually involves a human-centered design process, rigorous evaluation that feeds into the tech development through interacting with users and doing rapid prototyping, and then also rigorous evaluations like randomized controlled trials to understand the health and well-being impacts of the technologies and interventions that we're developing. And then also usually simultaneously thinking about what's the potential for a particular product or intervention to be able to be widely scaled up. So what's its potential for financial sustainability and wide implementation. And typically these projects involve key strategic partnerships with NGOs, other academic departments, and the private sector. So I'll just give you two examples of products that we've been working on. So you can go to the next slide, Alice. Yeah, so one example is a hand washing system that our lab has developed, which is designed to basically fill a need in settings where there's non-access to piped water supplies. And so there's a couple advantages for this technology, which is that it drastically reduces the amount of soap and water needed to hand wash. So it uses 90% less soap with an innovative foaming soap dispenser and 50% less water to effectively wash your hands. And this is hugely helpful in places where it's actually a lot of time and effort to refill hand washing stations with water in low-income settings. And we've evaluated the impact of this technology in schools and clinics and found that it's greatly reduced hand washing rate, greatly improved hand washing rates. And it has a potential to scale because actually the savings that you get from soap and water covers the capital cost of the system in just 6 months in most institutional settings. So next slide, I'll give another example.
Critical today under COVID-19.
Yes. Yes, particularly important for COVID in settings without access to piped water supplies. So this is another technology that we've been working on. So this is a inline chlorine doser to increase access to safe water in settings where piped water supplies are not always safe to drink. And the niche that this technology is filling is providing a technology that's compatible with low resource settings. So it doesn't require electricity, it's very low cost, it sources dilute bleach is the chlorine source. And most importantly, it takes the burden of water treatment off of the end user and provides kind of a higher level of service than other technologies that are available in the market that are at the same price points. And so the idea here is to make water safe by default coming out of the tap. And we have found that kiosk owners that are already selling water in peri-urban communities in Kenya are willing to pay for this device and provide safe water to their customers. And we've also done some health impact evaluations and found that it does have important health impacts. So it's reduced child diarrhea rates in Dhaka, Bangladesh, and reduces also healthcare expenditures among children. So now I'll just take a moment to talk about the courses that I'm involved with at Berkeley. So I teach 2 courses that might be of interest to students taking the Masters of Development Engineering program. One course that I'm going to be involved with is the DevEng 200 core course to design, evaluate, and scale development technologies. There's a lot of other faculty on the call, I think, that have can speak to the skills that you'll gain in this core course. But the idea is to develop plans for deploying, evaluating, iterating and adapting a novel technology or service in a low-income setting. And it's a really exciting class because you get to collaborate with an interdisciplinary team of graduate students from business, engineering, policy, and science. It's a really fun class.
And it's also taught with the Haas School of Business, and David Levine has taught it in the past. He's on the call here.
Yes, hi, David. And then another course that I teach, well, I will be teaching, is control of water-related pathogens. So this course is focused on understanding the pathogens responsible for waterborne disease in low-income settings, and thinking about developing and evaluating engineering and management solutions to improve safe water access and improve sanitation access. And also, you gain a perspective in this course on global challenges related to equitable provision of safe drinking water. So that's all I'll say for now, and I'm sure that there'll be a time for question and answer later.